Good morning, everyone, and thank you for joining us. We're here on Treaty 6 territory, and I also want to recognize the Métis people of Alberta who share a very deep connection with this land. This morning, I'm joined by my colleagues Lauren Dack and Richard Fian. Yesterday, Alberta Health Services reported that every Edmonton hospital is pushing patients into hallways in a desperate attempt to free up space in overwhelmed emergency rooms. Hallway medicine is an urgent signal of a healthcare system in crisis. My heart goes out to all Albertans who are being treated in busy hospital hallways and to their families and loved ones. My heart also goes out to the frontline healthcare workers, professionals who are being forced into this situation. Early August is supposed to be one of the quieter times of year for emergency rooms. But the AMA's head of emergency medicine, Dr. Paul Parks, described today's situation as, quote, disaster mode. I'm deeply concerned about where we will be in the early fall when respiratory illnesses and other demands on hospitals traditionally increase. We have seen the current disaster approaching for quite some time. Red alerts where no ambulances are available have exploded in Edmonton and area. We used to have a handful every month in 2019, adding up to a few minutes per month. But this year, there are hundreds every month, adding up to dozens of hours. One of the main causes of this is ambulances getting stuck at overwhelmed hospitals, unable to hand off their patients. Last year, for the first time, ambulances in St. Albert, Spruce Grove, Fort Saskatchewan, and Strathcona County spent more time responding to calls in Edmonton than in their own communities. AHS data shows the percentage of Albertans who are discharged from the Royal Alex and the MIS, as well as the U of A, within a 4-hour window is the worst it's been in 2 years. We looked across the province, and there are currently 29 communities where hospitals are partially or completely closed due to staff shortages. There is no one in the UCP leadership contest who's talking about this crisis in a serious way. No one in the UCP has acknowledged that the root of the problem is their attacks on healthcare professionals. They tore up contracts and threatened workers with pay cuts. They chased family doctors out of the province, leaving hundreds of thousands of Albertans with nowhere but the emergency room to get care. So we need a new approach from a new government, an NDP government, one that will bring resources to the front lines and that will restore the respectful relationship with healthcare professionals. And we will ensure that Albertans get the right care in the right place at the right time. Thank you, and I'm happy to take your questions. Is the audio okay?
We will start with.
It's a little yeah, if you can bring it down just a bit. It's a bit overmodulated. Yeah.
Thank you.
Okay, we'll start with questions here on location, and then if you have a question on the Zoom or the phone, please use the raise hand function or *9.
Hi, Shalane Skolsky with CTV News. Thank you so much for taking my question. You talk about a new approach from a new government. I'm just wondering what exactly that looks like. When I asked your leader, Rachel Notley, yesterday about renegotiating pay, as we know that there's a shortage of skilled staff right across the country, she was a little hesitant to say whether that was an option. What are you willing to do to attract staff?
Yeah, thanks for the question. And as the former health minister, I can say that number one is welcoming those professionals into the building instead of condemning them on TV or in their driveways or outside of hospitals. We've seen over and over again that this government has shown a high degree of disrespect and disdain. So I think that respectful negotiations don't just happen during a certain window. They start when the relationship's established. And certainly under a Rachel Notley NDP government, one of the first things we do is work to rebuild those relationships, have respectful dialogues, open the books, and have fair conversations with the people that are being trusted to save lives every day on the front lines. And we need more healthcare workers in Alberta, not less. And under the current government, we've seen a significant crisis, and it just can't continue.
Yeah, just as a follow-up, in the statement that I received from Alberta Health Service, there was some rhetoric referring to saying that it was common to see a surge in patients after a long weekend and that these measures are only expected to last a number of days. I guess, what do you make of that? Is this common? Is this part of the norm?
Early August is one of the quietest times, usually when we see an opportunity for hospitals to catch back up, for healthcare staff to take a little bit of a break or a reprieve, and we're really experiencing unprecedented wait times, red alerts, length of stay in emergency departments, rather than emergency departments, lengths of stay in emergency hallways. This is not acceptable, and certainly it's not something that I wish on any patient or healthcare workers. They deserve to have a safe and effective work environment, which includes the right number of hospital rooms, well staffed for patient care.
And you had mentioned that this isn't even the time when respiratory viruses are causing a surge in the system. If this continues, what could we see by the fall when the pressures really ramp up?
Yeah, and I think I can speculate as the former health minister, but experts like Dr. Paul Parks, who are experts in emergency medicine, would probably have even better evidence to be able to share. But what I can say for sure is that we do typically see an increase in the fall around back to school, around more children entering daycare, and traditionally that's when viral loads are higher, and there is more respiratory illness in the fall typically. We're already beyond the brink right now, and early August, which is supposed to be one of the more quiet times in terms of hospital emergency care. So what this could mean for the fall is incredibly scary, and it's one of the reasons why this government needs to fix the relationship as quickly as possible. Rather, we need a new government to fix the relationship with frontline healthcare providers so we can get back to focusing on patient care and making sure that they have the right supports in communities across this province.
And what is at stake if this continues?
To anyone who's currently in a hospital hallway or has been sent back to the parking lot to wait to be admitted, it is terrifying. It is time that is people should be able to focus on their own care and what they're going through, but instead they're in not safe situations compared to what normal health care would be. So there are people whose lives are at stake, absolutely. There are healthcare workers who mental health and their physical fatigue is at a breaking point. And if we want to make sure that we're ready and that we're able to offer quality public health care throughout the year, and we know that there's often a big uptake in the fall, this government needs to take it serious. Every single leadership candidate running for any party needs to make public health care and the support of frontline workers and patients their highest priority.
All right, we will now go to the Zoom. Janet, your line should be open.
Just wanted to touch on what you were talking about, increasing the investment in healthcare. And we know that healthcare costs kind of across Canada have been increasing as a proportion of the size of provincial budgets. So what kind of investment are you proposing? I know you were in government trying to keep it under 3% growth per year. Would that have to change, or that approach have to change to try and catch up with some of the deficit?
I think that the gap between what is fair, acceptable, good care for Albertans and where we're at today is bigger than we've seen in a generation. When we look at how many people are going without an ambulance being available, we're talking about, there was in January, for example, 40 hours one month, an entire traditional work week for somebody working a regular full-time job where there were no ambulances available. We were at red alert status. That is unacceptable. So absolutely we'll be working with our team to get ready for the upcoming election. We'll be putting forward proposals with specific targeted investment in healthcare, and we'll have a lot to say that in the weeks and months leading up to the election, and we'll have Albertans have an opportunity to make a decision about what's best. I, of course, work to find as many efficiencies as were possible at that time to be able to refocus some of that investment from, for example, certain drugs that were maybe not getting better health outcomes, to be able to focus that on bringing more drugs online or bringing more staff into different types of healthcare facilities. We'll continue to look for efficiencies wherever we can do so safely without compromising patient care, because that's important, but it's also incredibly important that we make sure that we staff up to appropriate levels, and that those who are working here in Alberta, regularly I hear from experienced healthcare professionals, nurses, who say that they're thinking about either leaving the public system or leaving the province. And that is unacceptable. Nobody who wants to work in public healthcare in the province of Alberta, who has a skill set that is absolutely at need, should be feeling like their government is pushing them into that decision. So we need to make sure that we restore actual respect for the frontline healthcare workers who have been so crucial to us, not just over the last 2.5 years, but in Alberta's history of public healthcare.
Do you have a follow-up, Janet?
I do. So apparently, Government House Leader, Finance Minister Jason Nixon says that his government is now going to take a look at requiring some kind of ministerial approval for any of these Public Service Commission bonuses for these extenuating circumstance overtime, like pandemic overtime, such as Dr. Henshaw received. What do you think about that? And what measures did the NDP government have in place to have any political review of any of these kinds of bonuses, such as like during the Calgary, no, it was before you, from Macquarie wildfires, let's say, yeah.
Yeah. I'm not surprised that he's saying that. I think Albertans across this province are rightfully outraged that at the same time, respiratory therapists, those who are helping struggling patients continue to breathe, that nurses were being pushed beyond breaking points, that doctors were leaving the province, leaving tens and hundreds of thousands of Albertans without access to a family physician. At the same time, the government was going after the pay for frontline healthcare professionals. They were writing bonus checks for people in senior leadership positions, 60% of their annual income. It is ridiculous to think that the government had no clue. They're either incompetent or they are lying. And either way, Albertans deserve so much better from their government. So I'm not surprised Jason Nixon's trying to come up with lines to backtrack and try to distance himself from the culpability that Travis Taves and others sitting around that cabinet table. The finance minister needs to know about the finances of the province. He tried to shrug off the $4 billion earlier this year, and now he's trying to say he had no awareness of these types of ridiculous bonuses. I think that's ridiculous.
All right. Carly, your line should be unmuted now.
Thank you. I'm just wondering, we know that the situation with hospitals being overwhelmed, we're seeing it in hospitals across Canada, as well as the tension here at home in Alberta. Do you have any calls for the immediate, for what needs to happen now to keep us from disaster in the fall, to keep us from disaster before an election potentially?
Thanks for the question. And certainly there are a number of pressures in a number of places across the country. They are the worst in Alberta right now. We have over 20 hospitals that are partially or completely closed in the province of Alberta. That is unacceptable. We have patients being sent Calgary Children's Hospital, for example, Alberta Children's Hospital in Calgary. We have children who they and their families are being sent back to their cars in the parking lot. We have people waiting in hospital hallways throughout every emergency department in Edmonton, trying to get emergency care in the hallway. Like, this is completely unacceptable. It's important that the government staff up properly, that they actually show respect to those who are struggling to make these difficult decisions, instead of making excuses for their awful decisions in terms of how they've handled the pandemic over the last 2.5 years, how they've treated frontline healthcare professionals, and how they have chosen to prioritize investments in things like massive bonuses for individuals instead of focusing on staffing up and making sure that we have the right number of professionals available to serve Albertans.
You have a follow-up, Carly?
Yeah, I'm just trying to get a handle on, is there a call for the right now, or is this just a campaign announcement at this time? Is there any call for actions to be taken right now?
Sure. I would say that probably the most immediate pressure would be that I hope that they are focusing on meeting with AHS leadership, meeting with worker representatives, and sitting down to make sure that the most acute pressures, that they're addressing them immediately. So that would mean finding out what's happening with staffing and making sure that they're working to put every single possible dollar that's necessary to put more people on the front lines instead of padding profit margins for certain individuals individuals or for private profitable corporations. This really is about priorities and choices. And we've seen over and over again that this government has shown an incredible amount of disdain and disrespect to healthcare professionals. So we still have doctors who have been without a contract for 2 years in this province. So if you want to actually cause some stability, create some greater certainty for Albertans, you need to sit down and you need to actually get to work on establishing a contract with doctors so that they'll stay in this province instead of leave. That would be one of the most pressing things that this government could do today. But ultimately, this government has demonstrated over and over again through the last 3.5 years that they can't be trusted with public health care. So we need to change the government, and we need to put in a team of leaders under Rachel Notley's leadership as Premier that will actually show long-term respect and proper investment for public health care in this province.
All right, and that's what we have time for today, folks. That will conclude our press conference. Thanks for attending.
Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.